Now for the hip extensor palpation muscles, turn around. We have the gluteus maximus right here, which is the big butt muscle, and that extends and rotates the hip outward. And you have your semitendinosus, which is one of your hamstring muscles that runs right here. This one is in the middle between the semimembranosus, which is medial, and the biceps femoris, which runs laterally. And all of those extend the hip and flex the knee. And then we have our hip abductors. So under the gluteus maximus, you have the gluteus medius and also the gluteus minimus. And those abduct and rotate the hip. The medius does inward rotation and the minimus does, or they both do inward rotation, sorry. And then you have your tensor fasciolata, you turn sideways. Your TFL runs all the way right on the lateral side of your leg. And that abducts, flexes, and rotates the hip inward. And then we have our IT band or iliotibial band, which also runs like that, but that is not, it just stabilizes your knee and keeps your knee locked. Okay, so for the muscle palpation, starting with the hip flexors, we have the iliopsoas. So that starts, those originate on the lower sacral region, kind of like right here, run right there, and then onto the pelvis, and then you turn around. And that does specifically hip flexion. And then you have the rectus femoris, which are just your quad muscles right here. And those do hip flexion and extend the knee like that, like kicking a soccer ball. And then we have the sartorius, which starts laterally, and then it's the longest muscle in the thigh and runs down like that toward the knee. And that one does hip flexion and knee flexion, and it rotates the thigh outward. And then we have the pectineus, which kind of like runs in this area too. It's like a short, thick, small muscle, and that flexes and abducts the hip. And then, so for the hip adductors, you turn around. Yeah. So they all kind of like run in here. And then we have the brevis, longus, and then magnus in that order. And those all adduct the hip. And the magnus also extends the hip. And then we have the gracilis, which runs like right in here all the way down to the knee. And that adducts the hip and flexes the knee. Okay, so here's the hip, joint, and pelvic girdle bony structures. So first we're starting off with the iliac crest, which is right here. Basically like your hip bones. And then the anterior superior iliac spine is like the little hook you can feel right here. And then the superior iliac spine is just right below that down here. And then we have the sacrum, you turn around, which runs down to here. It's like the lower part. And then you have your your greater trochanter is right here. It's kind of where your humerus like inserts to the glenohumeral joint. And then the lesser trochanter is kind of like on the inside and a little lower. And then you have the posterior iliac spine. Turn around. So you start on the iliac spine, do the windshield vipers, and find them right here. And then you have the inferior iliac spine, and that's just below that right here. And then you have the ischial tuberosity, which is, let me touch your butt, okay? Yeah. Which is right in here. It inserts right in there, and it's like where all your hamstring muscles insert. And then the pubic symphysis, I'll turn around. And just put like your hand on your belly button. And then right where his middle finger is right where his pubic symphysis is.